Can infections cause neurological disorders? This is a fascinating question that touches on the complex relationship between infections and our nervous system. Yes, infections can indeed cause or contribute to neurological disorders, a connection that is gaining more recognition in medical research. Various infectious agents, including viruses, bacteria, and other pathogens, can affect the nervous system directly or indirectly, leading to neurological complications. Neurological disorders involve damage or dysfunction of the nervous system, which includes the brain, spinal cord, and peripheral nerves. Infections can trigger these disorders by invading nervous tissue, causing inflammation, or inducing immune responses that can harm neural structures. Let's look at some specific examples. Certain viral infections have been linked to neurodegenerative diseases. For instance, recent studies suggest that some viruses, even those usually considered harmless, may play a role in diseases like Parkinson's disease. The human pegivirus has been found in a notable number of Parkinson's cases, indicating a possible viral connection to the onset or progression of this condition. Viral infections can also activate a process called neuroinflammation, where immune cells in the brain become overactive, potentially damaging neurons and leading to neurological symptoms. Bacterial infections can also be problematic. For example, infections that cause meningitis can directly injure the nervous system. These infections can increase levels of cytokines, which are immune signaling molecules in the brain. Elevated cytokine levels can worsen inflammation and may contribute to disorders like Alzheimer's disease. Another interesting area of research involves the gut-brain axis, which refers to the communication between our gastrointestinal system and the central nervous system. The balance of gut microbiota can significantly influence brain function and neurological health. Disruptions in gut bacteria, whether due to infections or other factors, can affect neuroinflammation and neurotransmitter production. This may have implications for diseases such as Parkinson's, Alzheimer's, multiple sclerosis, and even autism spectrum disorder. Infections can also increase the risk of stroke by promoting inflammation, blood clotting, and vascular injury. Respiratory infections and systemic infections have been associated with a higher incidence of strokes, likely through inflammatory pathways that affect the blood vessels in the brain. Understanding the link between infections and neurological disorders highlights the importance of preventing infections and treating them promptly. Aggressively managing infections in at-risk patients may help reduce the likelihood or severity of neurological complications, including strokes. Research into microbial therapies, such as probiotics that target the gut-brain axis, is ongoing, although these are not yet standard care. Clinicians must consider infectious causes when diagnosing new or worsening neurological symptoms to provide appropriate treatment. In summary, infections can indeed cause or exacerbate neurological disorders through various mechanisms, including direct invasion of nervous tissue and systemic immune responses. It is essential to seek personalized medical advice from healthcare professionals regarding infections and neurological health.